I'm Dr. Alex Hannenberg, a TeamSTEPPS Master Trainer, and I'll introduce a training session that I think will be both valuable and enjoyable. TeamSTEPPS is a teamwork system designed for healthcare professionals that's rooted in more than 20 years of research and training experience. It was developed by the Department of Defense and the Agency for Healthcare Research and Quality. It aims to improve healthcare quality and safety by helping teams work more effectively together. A concise summary of the program's framework is available in the TeamSTEPPS Pocket Guide. This is one of a series of training modules that allow the learner to experience situations in which TeamSTEPPS tools could be used to improve team communication and patient care. The video material does not depict actual patient care, and you will get the most out of the experience by not focusing on how the scenarios differ from your own practice, but by carefully observing staff and patient interactions and discussing your observations and improvement strategies in small groups. In this scenario, we'll closely observe staff reacting to a patient who becomes agitated during a clinic visit. Study how the team members work with one another and the patient under their care. What do they say? How do they say it? And what don't they say? Observing and discussing communication among team members is a great way to identify how TeamSTEPPS tools can be used to improve teamwork in our own clinical practice. As you watch the clinic staff trying to manage the situation, please pay special attention to whether staff members take opportunities to share information among themselves when needed, and if you see someone leading the team. Multiple staff members become involved in this event. Is each of them oriented to the issues at hand? Could tools like briefings and huddles have improved their effectiveness? While you're viewing the video, use the worksheet provided to jot down your thoughts about what you're seeing and what you might have said or done under the circumstances. Where might briefs, huddles, or debriefing have helped get everyone on the same page? Your notes will be helpful in the discussion that follows the video. The most valuable part of an exercise like this usually comes when we reflect on what we've seen and how it might help us get to be the best we can be. For that part of the program, you'll break up into small groups so that there's an opportunity for every participant to share their own observations and conclusions. Everyone should assume that all of the participants in your small group are intelligent, capable, and care about improving. You may have questions about today's activity, and this is a good time to discuss them with your facilitator.
So, what brings you in today?
Before we begin, do you think that you and I could speak privately for a moment?
I'm sorry, we're really behind today. We should just get right into it.
Okay. My mother has dementia and she tends to get upset easily. I think it's getting worse lately.
Janelle, how are you doing today?
I don't know. I wish everybody would just shut up. I don't even know why I'm here today.
Mom, it's okay. We're just here for a checkup.
Don't touch me!
Oh, Mom, please calm down. Oh.
Oh! I heard yelling in here. Is everything okay?
Oh,
No!
Mom, please.
Can someone call security?
Stop it!
I'm gonna go get Nora. In the meantime, can you calm her down?
I'm trying. I could use more help.
Mom, please, you gotta stop this. This is why I wanted to speak with you in private.
Janelle? Janelle? Please calm down. Listen, you're here at the hospital. Everything is okay.
Who are you? Don't tell me what to do!
Why didn't you call security?
I did. I don't know what's taking so long.
It's okay, Janelle.
Mom, it's okay. I'm here. I'm gonna take you home in just a minute.
Did someone call security?
Finally, this patient has been very combative, but fortunately, it seems like she's calming down a bit, but we could have used you earlier.
I'm sorry, I came as quick as I could. The nurse called the wrong line for security.
Thanks, I understand. We're all set for now, but I'll let you know if we need you again.
Okay.
Thank you. Thanks, Brian. I'll take it from here. Okay. So what brings you in today? And we might want to go over this quickly, just so she doesn't get upset again.
I'm sorry, but I'm really unhappy with what just happened. What are we supposed to do? How can I ever bring her back here again?
I apologize. I'm sure this is very difficult for you. But let's get through today and then we can discuss a long-term plan.
Okay, I suppose. That works for me.
Wow, that was intense. Hopefully she doesn't have to come back here again. That was the second time she's been combative like that.
I think it's time for the nursing home.
Yeah, that was a lot, especially for a day when we're running behind and we're double booked as it is.
To be honest, I'm a little shaken up. I've never had a patient try to punch me before. I was legitimately scared, and it took forever for someone to come and help me.
You have just seen a team of healthcare professionals react to an agitated clinic patient. We should assume that they are intelligent, capable, and caring healthcare professionals who are doing their best, as are you all. Now you'll spend time in small groups reflecting on what you've each observed in the video. Every group member shares responsibility for maintaining a respectful discussion and ensuring that every participant has an opportunity to speak. In this setting, it's important to put aside seniority and your professional role and speak freely. Each of you has something valuable to contribute. Start by spending a couple of minutes silently reviewing your notes and getting your thoughts together. Try to come up with a few explanations for the behavior in the video and how briefs, huddles, or debriefing could have improved teamwork and communication. Then, as a group, we suggest you consider the following questions. What was your overall impression of this scenario? What went well, and where did things start to go less well? What could the team have done to recognize the patient's daughter prior to starting the patient visit? Who was the leader during this situation? Who else could have taken on the role of leader? How could a leader help the team to be more effective? And how could the team benefit from a debrief after this situation? And what information should they share? We found it's helpful if participants rotate the role of discussion leader, perhaps by name alphabetically or by seating position. Also, be mindful of the time available so that you can cover the key points. Then summarize in 1 or 2 sentences what your group thinks is the most important behavior or communication tactic to work on in your daily practice from the TeamSTEPPS principles discussed today. Your group will share this with a larger group when you come back together. And then we'll show you a short video clip in which the team works quite effectively. We will now watch an example of how the team could have come together after the patient visit concluded, exemplifying good teamwork and communication. Consider how the behaviors displayed in this second scenario correspond to those TeamSTEPPS principles discussed today. Before you wrap up, your facilitator will take some time to help you identify the most important takeaways from this training. And remember, there are many resources available to help you learn and teach TeamSTEPPS on the program's website.
Okay, so a lot just happened back there, and I know we're running behind, but I think it would be good if we huddled up and discussed what we could have done better. How you doing, Brian?
To be honest, I'm a little shaken up. I'm still trying to process everything that happened.
I'm just finishing my report. Do you need anything else from me before I leave?
Actually, would you mind joining us for a quick debrief?
Sure, it's not a problem.
Thank you. All right, let's use the debrief checklist. First, was communication clear?
I think I could have called security sooner. Maybe I could have just stopped things and started a huddle.
I agree. We should have huddled with the patient's daughter beforehand. I mean, I came in when I heard the yelling, but I wish I knew you could have used me before that. In the future, please don't hesitate to call the nurses for help.
Agreed. Next, were roles and responsibilities understood?
Well, I wasn't really sure what I was needed for when I was called down here. Next time it would be good to know so I could be more helpful to everyone.
It's good to have you around because things could have gotten really out of control. I mean, thankfully the daughter was there to control the situation.
All right. Was situation awareness maintained? I know for me, I could have done a better job at this. I didn't know what I was really walking into, and it took me a while to orient myself. In retrospect, I should have walked in and asked questions to the daughter once I came in. Next, was workload distribution equitable?
You know what? I think I actually took the brunt of that. I think I might have a bruise to prove it. I think that this probably goes back to asking for help sooner. That could have made a difference.
Thanks, Brian. Was task assistance offered?
I offered to get you, and then I went and called security.
Thank you for doing that.
Great. Were errors made or avoided?
Well, I called the wrong number. It took me a while to find, and then when I finally called it, I realized it was to the hospital security and not the clinic security.
You know, I wish I could have taken the time to speak to the daughter, Angela, sooner. I think maybe next time I should probably listen to the family and listen to what their needs are.
You know, it can be tough to do that, especially when we're running behind, but I think that's a good reminder for us all. Anything else? Okay, next question. What resources were offered? I know we talked about getting security involved earlier.
Well, another resource to consider if you get in this situation again is the crisis line. If you call them, they have a social worker that's trained in de-escalation.
That's really good to know. All right, next question. What went well? I think we ultimately came together as a team.
You know, I was actually really impressed by Angela. We should probably call her back today and set up a game plan about how to do things better for the next time.
I agree. I'll give her a call after this. Last question. What should we improve? I know we talked about having help earlier, but is there a way to have the right security number and the crisis line available?
I can make sure you have the correct number for both.
Great, thanks so much, Ronnie. I'll put them up at the nurses' station and make sure everyone knows about it.
Okay, that's it. Does anyone else have anything else to add? All right, thank you so much. I think this was very helpful. But thank you for joining us for this debriefing.